Hi everyone, this is Divya from Quick Mommy Hacks, and today we have Dr. Devanshi Shah from Partum Therapy joining us to discuss about pre-pregnancy nutrition. So she is a pediatric physiotherapist with keen interest in moms and child's health and also in pregnancy, fitness, nutrition, and child development. She has helped several mothers during their pregnancy and postpartum phase. So thank you, Devanshi, for being here today to talk about pre-pregnancy nutrition. It's great to have you.
Thank you so much for having me on board. I'm looking forward to this.
So, Devanshi, my first question is when someone is planning to get pregnant, what role does nutrition play in supporting their path towards pregnancy?
So, nutrition plays a very vital role when it comes to prepping for pregnancy. What not many people know about is that you require a few micronutrients which are really important in the entire process of fertilization to have the healthy sperm and the healthy egg. Another thing is that if you're not in the habit of eating healthy, when you are pregnant, it might take a little time to actually move to that appropriate diet. And you really don't want to spend that time moving and changing your habits because there's a lot more happening that time. So if you're already eating the nutritious diet, it's going to make a lot of difference. By the time your pregnancy results come, you're already a few weeks through your pregnancy. So your baby's organs have started forming, the cells have started dividing. So if you're lacking those nutrients, there are chances that there might be a little problems out there. You want to really avoid that. So preconception diet should be appropriate. And it is shown by research that if you eat the right kind of diet, which is nutritious, you're going to have a good labor, you're going to have a comfortable pregnancy and a healthy baby. So yes, it is important that you eat right even before you plan to conceive.
So, do you think that your pre-pregnancy weight can have adverse effects on your baby's health?
Yes, your pre-pregnancy weight can have an effect on your baby's health if your weight continues through pregnancy. If
Okay.
you're able to reduce it, if it's able to go right prior to your conception, that is not with crash diets. That should be in a healthy way because, like I mentioned, nutrients are important. Again, at the same time, if you're obese or overweight, there are chances
Yeah.
you might find it difficult to conceive.
Mm-hmm.
Again, the mother during her pregnancy might go through various problems such as gestational diabetes,
Yeah.
hypertension,
Mm-hmm.
and there are chances that the child might have obesity and type 2 diabetes, which is something that you would really want to avoid.
Mm-hmm.
Another point which I'd like to make is not many people know about this, but you require a particular amount of fat in your body for ovulation to occur. So if
Mm-hmm.
you're underweight, you're not good with the fat, again, conceiving is going to be a problem for you.
Mm-hmm. So you mentioned that micronutrients are important. So what kind of what are the key nutrients you require in your diet before conceiving?
So I normally recommend three nutrients which are really important. The first, which I talk about, is iron, which is very important for the neural tube development of the baby. So neural tube is basically the brain and spinal cord of the baby.
Mm-hmm.
So you need to eat a lot of dates, a lot of figs, a lot of tofu. They are amazing nutrient options for iron.
Mm-hmm.
Again, a lot of iron supplements are required at the same time. Next, what we come to is folic acid, which is also responsible for the neural tube development and the cell division which occurs for the baby to form. For this, I highly recommend a lot of broccoli, asparagus, chickpeas, red beans. These are amazing options for folic acid. Third, what we come to is calcium, which helps in the overall fetal skeletal development. So, milk, eggs are amazing options, but there are women who don't really like milk. So,
Mm-hmm.
I'll suggest go for jaggery, sesame seeds, your green leafy vegetables. They are amazing sources of calcium.
So how about prenatal vitamins? How soon should you start taking prenatal vitamins, when you're planning to conceive?
So, I recommend you begin with your prenatal vitamins at least 3 months prior to conception. But at the same time, get in touch with a healthcare provider. Just get your tests done so you know that your nutrients are enough. In case if you're really lacking them, you might need a higher dosage of prenatal supplements. But 3 months should be a good time.
So what is the effect of bad nutrition on your pregnancy?
So we all know that when your baby is in the womb, it's getting everything from the mother. So if the mother is going to be depleted in nutrients, the baby is not going to get enough nourishment. But at the same time, even if the mother is just at the borderline of the nutrients, we need to understand the baby is going to take away its nourishment from the mother. So the mother is going to get depleted in these nutrients, which don't want. Another thing is, like I mentioned, anemia. Okay, so when the
Hmm.
baby is growing, there's a lot of blood which is required. Your blood volume increases in pregnancy.
Yeah.
So if you're going to be lacking iron and you're going to be lacking the blood, you're going to be anemic, and that might cause problem because there won't be enough nourishment going to your baby. This is all when it comes to undernourishment. Again, overeating, excessive eating is not
Hmm.
a good idea
Hmm.
because that could lead to your child having disorders that could last their life, like cholesterol, diabetes, obesity. Again, there are chances of a premature birth, a miscarriage,
Hmm.
vitamin A, which is often lacking in nutrition. There are chances of night blindness. So,
Hmm.
yes, nourishment is a key. If you are bad with the nourishment, it is going to affect you and your baby, which is something you really wouldn't want.
So, Devanshi, in your opinion, what exactly should we avoid or reduce in our diet when we are planning to conceive?
So the first thing is caffeine. So I would like to inform women out there that caffeine is not only coffee. It can be in the form of tea. It can be in the form of your hot chocolate. So caffeine has shown delayed conception. So please try and limit your coffee to maybe 2 cups a day, not more.
Hmm.
Next, what we come to is alcohol. So alcohol has an effect on both men and women, on their fertility in general.
Hmm.
So men have shown reduced libido, reduction in the sperm quality,
Hmm.
and impotence. So please avoid alcohol when you're planning to have a child. Next is smoking. We know smoking is really hazardous when it comes to our entire body, but
Hmm.
yes, it affects our reproductive organs. There is damage to the eggs and the sperm. But the good thing here is that the effects of smoking is reversible. So
Hmm.
if you stop smoking a while prior to conception, yes, you can have a healthy egg and the sperm can be good. So that's something I really recommend. But again, that does not mean once you conceive, you begin smoking because the effects are reversible. That wouldn't help. Next, what we come to is drugs or medicines. We know a lot of people out there take birth control pills. I would recommend stopping your birth control pills at least 3 months prior to conception. In the meantime, use some other method of contraception.
Hmm.
These pills have higher estrogen and progesterone levels, which could lead to limb and heart defects in the child. So please avoid these pills at least 3 months prior. Next, what we come to is a few medication what you can get in touch with your healthcare provider for. There are few
Hmm.
medications that interfere with the absorption of folic acid. So I would
Hmm.
recommend that you avoid that because, like I said, folic acid is really important when it comes to
Yeah. Hmm.
that.
So, what if you are not, planning to get pregnant and you get pregnant? So, what steps can you take to improve your nutrition during that time?
Okay, first of all, it's okay if you weren't planning and you are pregnant.
Hmm.
Okay, don't really worry. It's never too late to start. Get in touch with your gynac. Okay, begin with your prenatal supplements. There are chances you're giving a higher dosage to cover up for the time. Okay,
Hmm.
and like I said, it's never too late to begin eating the right form of food. So start that day. Do not wait any further.
And are there any additional tips that you would like to give women who are planning to conceive?
So I recommend women out there that eat nutritious food. That is really important. Include all the nutrients in that. Hydrate really well. Drink a lot of water. Have the optimum weight before you plan a baby. Remember
Hmm.
not to go on those crash diets. Just go
Yeah.
healthy. Have your prenatal supplements. Please do not cut out on those. Exercise, even if it's for 15 minutes a day, do something that you like. It can be in the form of cycling, swimming, walking, anything that you like. And yes, please cut out on alcohol, caffeine, tea, smoking, all of these things.
Yeah, so I think like you pointed out at great things here, specifically hydration and exercising, because hydration is sometimes very difficult to supplement your body with that much amount of water, and also exercise doesn't always happen because you're most of the time tired. But I think th those particular things are great to include when you're trying to conceive. Those are very good points. So thank you, Devanshi. Thank you for joining us and for sharing your thoughts with us. It was a great conversation.
Thank you so much, Divya. I hope this helps women out there. Thank you.
I'm pretty sure. Thank you. Hey everyone, thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and don't forget to follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood. Also, do feel free to reach out to Dr. Devanshi Shah from Partum Therapy for any fitness sessions or nutrition consultation. You can always DM her or reach out to her on Instagram. Also, do leave your comments below. I would love to hear from you.